It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
All right, our first guest is Avi Goodman, a doctor and orthopedic surgeon at Evergreen Health, talking about Dupuytren's Contracture. Dupuytren's, I only remember that name because I've seen John Elway doing commercials for it on TV. Shannon, what is this?
Yeah, it's not an uncommon thing for that you see in the media and you hear about people having it. That's a contracture that forms in your fingers, your flexion portion of your hand. So your fingers, particularly your third, fourth, and fifth digit, become contracted or bent in kind of like you're gripping all the time, and the tissue becomes contracted. So we're going to talk about Dupuytren's Contracture.
All right, Dr. Avi Goodman and Shannon O'Kelly.
Dr. Goodman, welcome to Health Talk. How are you?
I'm doing very well. Thank you very much for having me.
Absolutely. Excited to talk to you. But before we get into the topic today, which is a big topic called Dupuytren's Contracture, I always like to talk to our guest about their background, their interest. You have a fellowship training in upper extremity, trauma surgery, hand surgery. Tell us about your practice and maybe a little bit about your training.
Yeah, absolutely. I am at Evergreen Health in Kirkland. I'm a hand and upper extremity orthopedic surgeon here, and I really treat the full spectrum of hand, wrist, and elbow pathology. Our most common conditions are those like nerve compression, such as carpal tunnel syndrome, trigger fingers, arthritis, as well as fractures, ligament injuries, and trauma, as well as Dupuytren's Contracture, which is what we'll talk about today. And it's really gratifying and interesting to have a practice that includes both people who have a slow progression of their pathology over years, to those who fall on the ski slope or the mountain bike trail, and those who got their hand caught in a lawnmower. So we really treat all types, and we generally do treat both adults and adolescents.
How'd you become interested in this? This is a very detailed area of the body. The hand, anybody can appreciate if you ever smashed your thumb with a hammer or cut your finger. I mean, you use your hands a lot. Very detailed, a lot of bones, a lot of ligaments, very complex area. Why your interest in this area of complexity?
Well, so I think that you've really hit on a lot of points. So I originally was interested in orthopedics as a natural choice. I studied biomedical engineering in college, and orthopedics offers really pretty good mechanical solutions or problems, and we see the results quite quickly. And then from there, a transition to hand and upper extremity. The hand is really just this beautiful combination of anatomy and physiology all combining into function. And to me, that's what's really important, is getting patients back to function and figuring out how we can do that through really often mechanical solutions. So just like I said, very elegant, and it combines a good spectrum of practice from power tools to working with a microscope and everything in between.
It's an amazing area of practice. I have a lot of respect for what you do just based on the details and complexity of the upper extremity. Tell our listeners, when you talk about patient-centered care, I love that term in today's world of medicine. What's that mean to you as a surgeon?
Really, the philosophy is to get people back to doing what they love and what they need to do, which starts by understanding what they're about and what their goals are. By combining this experience with the different options around their pathology, we work with the patient to put together a treatment plan that really meets their needs most individually. And oftentimes this means modifying their activities, trying hand therapy or injections or bracing, but sometimes surgery may end up being the best way forward.
Our topic today is Dupuytren's Contracture. What it is, how you diagnose and treat it. We're going to get in the nitty-gritty here, okay? Dupuytren's, what is it?
Absolutely. So Dupuytren's Contracture, which is also called the Viking disease, is a benign process that involves thickening of some of the soft tissue of the palm of the hand known as the fascia. Over time, this can develop nodules and thick cords and can harden, and most importantly, can cause a contracture that bends the fingers down to the point where they can't be opened. It's generally irreversible, although sometimes the disease progresses pretty slowly. Unfortunately, right now, there's no medication or other treatment that can be given to slow or stop the spread of the disease. The best we can do is to recognize it early and then to treat it appropriately. It can sometimes be confused with a trigger finger, which is more of an inflammatory problem, but also causes bending of the fingers. But with trigger fingers, the fingers can be straightened out, whereas in Dupuytren's Contracture, they're just stuck down.
Who's prone to Dupuytren's? Is it a gender specific? Is there an age group? Is there hereditary? You said Viking's disease, but maybe you can talk about that.
Yeah, so it's actually pretty strongly heritable. Not everyone will have a family history, but many people will. It's most often people of Northern European descent, so people German, Scotch, Irish, Scandinavian who get this, but not always. Men are more common than women, and it's much more common as we get older. But it does happen to people who are younger as well. Sometimes people also have similar diseases elsewhere in their body, like fibrosis in the soles of their feet. And some people who have a number of these different things, they get get it at a young age, they have a number of different family members, they have it on both sides, they're much more likely to have a disease that's a bit more aggressive, and therefore we need to treat it a bit more aggressively.
More with Dr. Goodman and Shannon O'Kelly next on Northwest News Radio.
It's a Northwest News Radio weekend. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
We continue our conversation about Dupuytren's Contracture with Dr. Avi Goodman and Shannon O'Kelly.
Dr. Goodman, again, thank you for joining us here on Health Talk. Fantastic information regarding Dupuytren's. Let me ask you, though, how would one know maybe I'm getting this condition early on, and when should I maybe seek attention or consultation from someone like yourself? I mean, let's talk about signs and symptoms and progression of Dupuytren's.
Typically, the signs or symptoms are developing nodules in the palm or among the fingers. People notice it most commonly when their fingers start to bend down more and more, and they're not able to straighten it. But really, it's when you can't put your hand flat on a table is when we really start to think about doing something about it.
Yeah, and so they're going to get this, and they're going to come see you, and you're going to diagnose it. Basically, talk about the diagnostics and maybe the treatment, and from a standpoint, maybe what you can do from maybe an injection standpoint to when do they need maybe a surgical intervention.
Absolutely. So when they come and see me, we take a look at their hands. We'll oftentimes get an x-ray to see if there's any coexisting arthritis that could change our treatment plan a little bit. Interestingly, this is actually one of the few conditions where non-surgical doesn't really play a big role. While we usually try to avoid invasive things, it just doesn't respond to therapy, steroid injections, or anything else that we've tried. And so we do treat this in a few different ways. The oldest method is to do surgery. In this, we really pretty carefully dissect out the disease tissue. We separate it out from the nerves, the arteries, and the skin, and remove the disease bit wholesale. This is generally the most effective treatment, but also the most invasive, which is why other methods have been developed. Some doctors will do something called a needle aponeurotomy, which is essentially numbing up the finger and then using the tip of a sharp needle as a knife to slice through the cords without making any incisions. While this is the least invasive, the results generally depend on the skill of the doctor, and even at their best are not as reliable as the other methods. The last treatment is an enzyme injection, and this is newer, having only been approved by the FDA about 12 years or so ago. This uses an enzyme to dissolve the cords only, avoiding the other surrounding tissue like the tendons, and avoids the need for surgery. It's really very satisfying. Our patients come back, and after numbing up their hand, we can straighten the fingers in a way that seems almost like magic. It's pretty close to, but not quite as effective as surgery, but it does keep patients out of the operating room, either for those who are too sick to be there or who don't want to undergo a whole surgery. The recovery process generally takes several months, but it's pretty straightforward. We need to get the skin to heal, we need to get the fingers to stay straight, and that's about it. So we'll work with hand therapists like our colleagues at IRG to make splints and to work with the patients on keeping all of their newfound motion.
Is this something that maybe 2 or 3% of the population will get?
Yes, it really depends on where you're looking. And so if you're looking in a place like Asia, it's pretty low, the low single digits. But if you're looking in a place like Iceland, it can be up to about 30% or even more of the population.
Great information. Dr. Goodman, thank you so much for joining us. I look forward to having you back on and talk about some other complicated or interesting hand injuries. You did a great job. Thank you for your time.
Absolutely. Thank you very much for having me.
That's been Dr. Avi Goodman, orthopedic surgeon at Evergreen Health, talking about Dupuytren's Contracture. You mentioned the way that affects your hand, Shannon, and for a guy like John Elway, who made his living throwing a football, that has to be, if he were still playing, that would be a very, very difficult thing to have to go through, if not impossible.
Absolutely. It would be impossible to throw a football when your flexion or your fingers are flexed in a contracted state, but it can be treated. And here at IRG, we have CHTs, certified hand therapists that see this type of situation, can help with splinting and some techniques and some things that we can do to help you stay functional so your fingers don't flex forever, so to speak.
Yeah. All right. Thanks to Dr. Goodman, and you can get more information at evergreenhealth.com. Our next guest right after this on Northwest News Radio.